The Uganda Public Finance Management Act came into force in 2015 and provides for prudent fiscal policy and macroeconomic management. It also guides on the processes for the preparation, approval, and management of a transparent, credible, and predictable annual budget. Civil Society Budget Advocacy Group, CSBUG, is a coalition of national and sub-national civil society organizations and individuals formed to influence Government of Uganda's decisions on resource mobilization and utilization for equitable and sustainable development.
CSBUG is the Civil Society Budget Advocacy Group formed in 2004 with the major purpose of ensuring that we have a budget that dignifies humanity. For us, we believe that resource allocations, the way they are mobilized, the way they are utilized, should transform the lives of its people. There are three major reasons why we are interested in public finance management. Number one, we know that the budget is the most critical tool that the government uses to transform its people. Number two is that we know that the budget is the most important instrument that can deprive its citizens of opportunities and livelihood. But we know also that a budget can be a source of reducing inequalities in the communities.
Together with the coalition members, CSBUG has made important steps towards ensuring that the budget-making process in Uganda is participatory and citizens' concerns are prioritized in the budget allocations and implementation.
Through the Equal Opportunities Commission, we now started lobbying for the Public Finance Management Act to have provisions in there so that these vulnerable groups can be put in the different budgets. So still the lobbying came up, the speaker understood this very well. She actually brought on board something which was called gender and equity budgeting. Actually, CSBUG did a lot with other civil society organizations, and actually we got almost 4 provisions in the Public Finance Management Act that was strictly speaking to the gender and equity budgeting. And it was very clear that all institutions of government, all ministries, departments and agencies should now plan, and in their plans we should see where the vulnerable people are going to be put, and in terms of budgets, what are they going to benefit.
Sometimes we make laws without consulting people, but this time it was an advantage that we had a hand from CSBUG, where they brought many people from the grassroots. This act, to me, was very, very good.
CSBUG has an outreach structure that includes regional budget coalitions. These are civil society organizations that are all over the country and in 14 sub-regions. We also sought to work with participatory budget clubs, which is another outreach structure.
With funding from the Democratic Governance Facility, DGF, CSBUG implemented a project during 2018 to 2020 called Promoting Inclusive Public Finance Management (PIP) at national level and in 12 districts of Chibale, Kakumiro, Bushenyi, Shema, Kanungu, Rwanda, Kabale, Pade, Agago, Abim, Chibuku, and Budaka.
We sought to achieve 3 key results. One was on promoting structured collaboration with government for open and inclusive PFM processes. We also sought to amplify citizens' voice in promoting gender-responsive budgeting and service delivery. And the third result we sought to achieve as an organization was to strengthen our capacity as a membership organization to steer advocacy on gender-responsive and inclusive service delivery and budgeting in Uganda.
On strengthening collaboration, this PIP project fostered accountability, fairness, and transparency at both central and local government level in ensuring a responsive citizens' budget and service delivery.
We started by sharing information because that used to be like a missing gap.
CSBUG has over time monitored our reforms, the 2 PFM reforms, and that was on timeliness, on the release of funds and the display of budget information in districts and service delivery centers.
At the start it was loggerhead, you give it, we take it, you give it, we take it. But now we are, you know, we have that symbiotic relationship. We are seeing ourselves as government, that we have a common goal, we are not enemies.
The PIP project supported amplifying citizens' voices through creating spaces which led to prudent PFM such as Annual National Budget Month, symposia, regional conferences, monitoring service delivery points, and conducting community dialogues.
When we have the national budget consultation, we will make the civil societies to make a presentation looking at how we have performed, but also looking at new government programs.
CISBAG was also co-opted to be part of PEFA process and PFMA index. Of course, this helps us in trying to see which areas we are weak and which areas then we can initiate a reform.
CSBAG mainly concentrates on budget. We do work on tax. However, what we have also done is to be able to look at the entire revenue cycle. That's mobilization, allocation, and utilization.
We track the performance, we look at the and this took us from budget to the joint sector annual reviews to the planning process when the sector is preparing their sector investment plans and now our program implementation action plans. We are on those tables.
I've engaged with them in budget advocacy symposiums. In addition to that, we have also engaged in advocating for increase in budgets, especially to support youth activities.
CSBAG's structures, the regional partners and participatory budget clubs, PBCs, worked with the different duty bearers at local governments to positively influence gender-responsive budgeting in key sectors of the economy.
Their entry into the community was through formation of budget participatory clubs, whereby they engaged the community and they identified people who were to champion the aspect of promoting inclusive finance management in the district.
One thing that CSBAG always does is to come with facts. His evidence always makes us as local governments make equitable decisions.
In the health sector, for instance, the project was successful in raising citizens' voices at various platforms and fora with responsive state actors.
The issues were varied, but significantly they raised the issues of infrastructure at Tirinyi, Kasasira, Chibokwere Center for Dodoi, Matente Ward, and of course some cases of staff indiscipline and poor service delivery. And fortunately, those issues were raised at higher district level, and as a department we took it up and we embraced those issues raised, and we were able to address one by one.
CSBAG, when they reached that place, they first visited me and said, "Do you know what is happening in Dodoi Health Center?" I said, "Yes, I know. I've gone there on a number of occasions. One, the roof is leaking. Two, they lack a lighting system."
Engo batukwanira siringi twine sola yaka nebikozesebwa bibamu.
Some staff houses were in a dilapidated state, so CSBAG brought it up. It was presented even pictorials. People actually rang and said, "Hey, you mean Shuku staff houses are just like this?" And as I speak, there is a 4-in-1 staff house which is being constructed at Shuku.
According to Dr. Dennis, the in-charge Shuku Health Center 4, women in labor faced hardships before the blood bank was installed at the facility.
We lost a mother because the mother needed transfusion and we had to refer the mother, and then the mother died on arrival on the receiving facility. And since then, we have not had any such incidences.
Before CSBAG came, it was Health Center 2, and now it has been upgraded from Health Center 2 to Health Center 3. Now the people were going to Chitagata for health services, they are now getting them from here. We can do antenatal from here, we can admit patients from here, at clinic is done from here, and mothers are also delivering from here.
There was an issue in Ruhija Health Center 3. The ceiling for maternity ward was almost collapsing. However, the issue was tabled very well by CSBAG and the LUSU advocates, and we discussed it. We had to make sure to put in the budget and repair that ceiling.
Mazima tutamburaga turukuza hale obuhereza butuli hale konka kutwabwine maternity tubasha bajikora yabonera hatushemerigwe abo kuba ntuzarira hihi kandi tutasabana bitu kurunji.
Advocacy by Lusudi, a CSBAG partner, enabled installation of a new vaccine fridge with solar power system at Mukol Health Center 2 in Rwanda district. This has saved patients time from going to other far-away facilities to access similar vaccine-related services like immunization. Through its PBCs and partners, CSBAG improved education outcomes by monitoring and engaging the duty bearers to address the gaps identified in mainly disadvantaged locations of Uganda.
They looked at things that challenge education with the performance itself. They talked to parents, they guided them, they counseled them, they brought them on board to change their mindset.
We found out that Paddy Clark Primary School have challenges in desk. We did dialogue. These challenges, we brought it in the council. As I talk now, with the plaza, Paddy Clark Primary School is equipped.
We have enrollment of 1,056. We used to have only this, but now we thank the government to have given us another pit latrine of 5 stands.
We lasted at least 3 years without a female teacher here, but we were greatly honored by the late Save Uganda and CSBAG in connection with the community around, who greatly assisted us to get a female teacher.
We have been studying in a class which is not cemented and which is not smeared, but we are now studying in a clean class. We are promising to make a lot of first grades because we are studying in a clean environment.
We are very happy with CSBAG for helping us in constructing these buildings we are looking at after the old ones of ours collapsed. We are seeking for more assistance because some of the children are still taking their classes in the tents.
Access to safe water at service centers has been promoted through the PIP project, and as a result, wide segments of the population at households, health centers, local government headquarters, and education facilities have been saved.
Some places really could not find even a spring, nothing completely. But because of CSBAG, because of the information we are getting, planning, budgeting and planning, at least when you go there now today, even as a lay person, you can witness that there is something on the ground.
We have an area in Kabweri. It is a full parish called the Komodo Parish. The water level, I think it is high. So they commit during the budget conference with CSBAG that they organized. They were able to advocate for a piped water, and indeed the district had to give them piped water. And as I speak right now, the issue of water in the Komodo, that part, it has no problem. People are taking safe water.
A population ijitabaye nayo ngo mukali wawo kwiruba azoesa woti kuwa sawa isatu ayira sawa musanvu ebyabaire nga bijo maka asasa ngolugambo abana baire bwire.
We have been able to mobilize citizens at local government level whose capacities we intended to strengthen in budget monitoring and accountability. We have also been able to mobilize our members at national level through the thematic working groups that are aligned to government sectors, including agriculture, health, water and environment. Their capacities were strengthened in budget analysis and advocacy.
We are happy that even as people we have evolved even in our capacities, but also integrating the issues of financing in as a core of what we are doing. The way agriculture as a sector is being appreciated in the funding corridors is not the way it was when we weren't having this aggressive budget engagement.
Civil society also started for us a website, which we are taking over anytime. We have started the process of taking over.
We can count on the efforts made by CS-BAG on providing training on policy analysis, especially analyzing the budget at national level, at district level, and also how the skills on how to draft and also make presentation on the position papers.
We have been able to go online, be digital, use digital platforms, especially, for example, the Bionic in paying our volunteers and other service providers.
In leadership, as a result of the capacity building, the project witnessed elevation of former PBCs to key elective positions in government.
I've worked with CS-BAG for a long time. Then in 2021, I contested as a youth councillor and I won the elections.
Now I'm a honorable councillor of Kabweri and Kenkebu, representing those people, and I'm a decision maker also in Chibuko district.
The project encountered some key challenges, especially COVID-19.
The challenges that were actually brought about when DGF was put on hold, it also affected the project, and that is one of the challenges. I'm happy that that process of lifting the ban has come out. Secondly, coronavirus, that is COVID-19, also affected part of the implementation or continuous engagement physically with local governments as restrictions adhering to the SOP was actually heightened.
The PIP project has demonstrated that inclusive public finance management could go a long way in deepening accountability and quality service delivery.
CS-BAG and other civil society organizations should continue drumming. They should continue engaging, because the good thing with CS-BAG, they are up to the grassroots. They engage the local governments, which we never used to do before.
Much more can be done, but unfortunately we only had funding for 12 districts. Imagine if this went across the country, what kind of transformation in our citizens, in our accountability systems can we see?
The PBCs, the CBAs we have already formed in our communities are helping us to sustain the already initiated ventures, because they are still participating in these budgeting conferences, and they are also monitoring service delivery.
They should be able to think more about their capacity building and also think more on how to access the information, which is very critical in this process.
One of the challenges we have in this country, in developing countries, you start a program, after the funding has stopped, you never heard of a program again. But if these people have information, even when you have stopped, you know that this program would be sustainable because the people had participated from the word go.
We need to continue working on transparency and accountability, because with the little money we have and expecting oil revenues to come in, if we don't become vigilant, if we don't become active in demanding accountability, in following the money, in conducting researches, monitoring government programs, we will lose out our citizens.